Hello to all of you. Welcome back to Kris Vanhaecht on Quality. Today's episode is a little different. We're actually packed with stories straight from the heart of Singapore's healthcare system. My name is Jolene. I'm a new host here at this podcast series. I'm joined by Professor Kris Vanhaecht, my supervisor here at KU Leuven, and Kris, you've just come back from a study trip there with Erasmus alumni, haven't you?
Yes, Jolene, it was quite an experience. So much to reflect on. The study trip was indeed with my friends from Erasmus University. They have an interesting Center for Care Policy. The leaders of that center are Wilma and Relinde. These two colleagues were supported by Ton of Dentre Care, a tour operator specialized in healthcare study visits, and Relinde asked me to also join the leadership group as we had a group of about 30 medical doctors who we trained in clinical leadership over the past decade. So, to be honest, I was really looking forward to meet them all again, and a lot of them were already real friends even before this study trip. With some of them, it felt like we met the day before, although it was sometimes 4 more years ago. Heartwarming.
I can imagine that, Kris, but tell me something about Singapore.
Singapore it's really fascinating in how they view health. It's not some isolated policy. It's woven into everything: urban planning, housing, economy, even education. Almost like healthcare as a strategic pillar, very consciously built. One of our guest speakers said, we integrate health in all policies, so really in all policies.
It's amazing to think such a small country, about 50 by 30 kilometers, and a population of a bit more than 6 million inhabitants, has become a world leader in health outcomes. Life expectancy there is actually higher than the Netherlands and Belgium, right?
That's right, 83.5 years if I remember correctly. And the thing is, they've done this by emphasizing long-term planning. Singapore was only founded around 1960. Can you imagine that since then, so in the past 65 years, they only had 4 prime ministers? Only 4.
That is also a bit different than here in Belgium or in the Netherlands.
Yes, indeed. And super interesting is that their Healthier SG strategy stands out. Every resident is connected to a permanent GP, and the care is organized into 3 main clusters: the National Healthcare Group, the National University Health System, and SingHealth. Each cluster is responsible for about 1.5 million people working alongside GPs and community partners. It's very much about prevention and managing health over the whole life course.
So data-driven too? I've read they've poured billions into linking health data across systems, so everything gets monitored nationally and even down at the individual level.
Absolutely. Data isn't just an add-on in Singapore, it's the foundation. They're aiming for total integration by 2030 with the EPIC system in all public hospitals. But, there are also questions about privacy and how that data will be used. That is still open, and not everyone's entirely comfortable with it.
Can you say a bit about the political culture and the leadership behind all this? I know you've spoken with Professor Ernst Kuipers, who has a foot in both Dutch and Singaporean systems.
Yes. So Singapore's had unusual stability. As we said, they've had only 4 prime ministers since 1959. The People's Action Party has been in power almost without interruption. Ministers often come from the business world, and the top civil servants are highly educated, sometimes with international backgrounds.
And why did you speak to Ernst Kuipers? Isn't that the former CEO of Erasmus University Medical Center?
Ernst Kuipers is now the vice president of the Nanyang Technological University in Singapore. But before that, Ernst was indeed the CEO of Erasmus University Hospital, and just before he left for Singapore, he was the Minister for Health in the Netherlands. I had the pleasure to meet Ernst before, during his time at Erasmus and as minister. So he was our perfect host. He also knew most of the delegates of our study trip, and he even gave an online introduction a few months ago to prepare us. Also, Wilma and Relinda had, of course, super contacts with him via their Erasmus link. So it was a pleasure to have a familiar person who could guide us and explain of the strategic choices and link them with the culture and structure of the country. A blessing for us.
I can imagine that he was a perfect host, as he understood both systems, Singapore and the Netherlands, and maybe also Belgium.
That is correct. He really stressed the value of a kind of systems thinking in Singapore, and also that it's a double-edged sword. On one hand, you have incredible implementation power and lots of money. On the other, there's sometimes a tension between central control and the autonomy for clinicians.
That's a big contrast to Belgium or the Netherlands, where, well, the fragmentation can be incredible. But just to finish this bit, it sounds like health really does underpin their nation building, and political continuity helps make these 30 or 40-year plans a reality.
Yes, and an important cultural note, and Ernst and also other experts from the Singapore government repeated this: there's no free lunch in Singapore. There's a strong emphasis that if you want something, you also have to contribute. But the flip side is that families are incentivized to look after each other. For example, living together in government-supported housing blocks comes with benefits. It creates a sense of mutual responsibility that's quite different from Western European models.
I love that idea of blending responsibility at the community level. So, Kris, let's talk about where you actually went, because the sites you visited tell us a lot about how Singapore puts strategy into everyday practice.
Definitely. One of the first places my subgroup visited was Kallang Polyclinic. These polyclinics, whether it's Kallang or Queenstown, are like the physical embodiment of the healthier SG vision. Integrated primary care, prevention, chronic care, mental health, diagnostics, all in one.
And with some cutting-edge stuff in there too, right? I remember you mentioned Dr. Valerie Teo.
Yes, Valerie is a real leader in telehealth and innovation. She's pushing for integrated care, for connecting medical with social support, and she's deeply involved in training new family doctors. But it's the day-to-day impact that stands out. Each resident is really seen as the clinic's long-term responsibility. And by the way, there's a digital backbone, telemonitoring, apps, lifestyle platforms that keep the contact constant even outside short appointments.
That kind of seamless contact seems years ahead of a lot of Europe. And you also saw how their green lines mean patients move smoothly from acute hospitals to community care or even back home?
Exactly. That is the goal. That day we visited in the morning in Queenstown, where Professor John Wong and his team introduced us to the Health District Queenstown, a national pilot to create a longevity-ready neighborhood. This was impressive, how they organize care and how all care facilities are within a radius of 400 meters. So also here they organize things so the elderly population can participate. Through conversations with residents and local partners, we saw how community engagement, prevention, and blended care are being woven into daily life, from wellness activities in public spaces to peer-led support and research on healthy aging. The visit offered a living example of how healthcare can extend beyond hospitals into homes and communities. We had lunch, a really good lunch, at the local food market. So we were really between all these beautiful people. Some were eating, some were having a chat, some were playing chess, and some were exercising. I took some great pictures that day. A pity you cannot see them, but they are on my Instagram account.
Oh, you practice is your hobby, Kris. That is great to hear. I will have a look at your Insta. But when I hear the story of Queenstown, I was particularly fascinated by your visit. Wasn't it the city as a healthcare tool?
Yes, Queenstown is Singapore's first health district. Here, health, housing, even walking routes are designed together. There's the plan now to build this elevated walkway, about 400 meters long, linking buildings so elderly residents can walk safely in the early morning or late evening. It's responding to a real-life problem in a super practical way. What really struck me, we met residents who showed us their personal health scorecards, literally tracking their own lab values and outcomes over time. There was this real sense of ownership over individual health.
But you also told me something about self-ageism. What is that?
Self-ageism, that notion of people underestimating themselves as they get older. So, yes, they underestimate themselves. That is not good. In Queenstown, that's actively tackled by encouraging participation and capability, not just protection.
It sounds like there's genuine pride and actually activation there, not just a focus on safety. Almost a kind of empowerment that's designed into the system.
Yes. And it's intentional at every level, blending the strategic with practical day to day. The blend between innovation and lived experience is really what stood out everywhere we went.
Now, Kris, I wanted to go deeper into something in your area of interest, and that might surprise people. Singapore used to use JCI accreditation in their hospitals, but they've moved away from it, haven't they?
Yeah, that's right. Since about 2015, they intentionally dropped JCI for public hospitals and also from private hospitals. The consensus was the procedural workload got too high compared to the actual improvement in care. That is something we have noticed in 2020 in Belgium, and when I hear my Dutch colleagues who were with us in Singapore, that is also what they are talking about. So Singapore developed their own model, ESS, or Enhanced System for Standards. It's really a shift towards a learning culture, ongoing peer review, monthly feedback, and lots of internal coaching, not a single annual audit.
So less box ticking, more actual improvement then. Do they still have inspections and standards at a national level?
Yes, definitely. Licensing and inspections still happen, and there are government-set norms, but ESS moves the emphasis from meeting a standard to a more substantive dialogue about practice. Peer teams visit each other, and quality is really pushed down to unit and team level. But they now have two separate parts. One is licensing. So the government decides if a hospital can be open, and next to that, they have a learning community ESS where they explore areas for improvement by using peers to be their critical friends. When I heard that, it is exactly what we are doing in Flanders with Flacom, our Flanders quality model. But the ESS in Singapore is 5 years ahead of us. So super interesting for me to hear about that. It was my colleague and friend, Professor Joke Van, who explained it all to us. He is also highly linked with the IHI in Boston, so we have common friends like Pedro Delgado. We even say we both are IHI family members. That is an interesting connection, of course, when we talk about social capital.
Tell me something, Kris, about the number 180. Why were you so impressed by the number 180?
Oh yes, that is an interesting one. I think something a lot of Belgian and Dutch policymakers will be jealous about. There's an annual national meeting too, about 180 leaders, 6 from each of the 30 hospitals, where everyone agrees on the national priorities for the year. That message is expected to filter top-down through all 30 hospitals, so the strategy isn't just written, it's performed at every level. So they code sign there, but also need to listen to what the government suggests or decided. During that meeting, everything is explained, strategies are set, priorities are defined, and even slide decks are shared. And those slides will be used in all of the 30 hospitals. So, strategy, not only in thinking, but even one defined strategy in communication. A bit too top-down for us, but it works.
That coherence is a bit of a dream in Europe, isn't it? What were your takeaways for places like Belgium or the Netherlands?
Coherence is the word. Singapore's approach isn't a menu where you pick one reform. It's about how the parts all reinforce each other. Strong regions, long-term planning, digital integration, ongoing learning cultures. For Belgium or Flanders, there's a lot to learn. Even acknowledging our different scale and political context. Invest in regional health managers. Consider quality as something to be learned rather than audited. Build digital systems that truly connect, and above all, bring all actors, politicians, professionals, civil servants, into alignment for the long run. And that's not easy.
So did also the Dutch colleagues had some learning points?
Yes, at the end of the visit, we had a roundup led by Wilma, and what was great is that all hospitals had to make an action plan based on the things they learned. So that was great to hear, but one of the delegates of the study trip was Ad Melkert. Ad Melkert is a former minister and top advisor of the World Bank and the United Nations. He has an impressive curriculum. It was a joy to have him with us, because Ad is nowadays the chairman of the Dutch Hospital Association. As Ad Melkert reflected at the end of our trip, it's this strategic, systemic approach that allows Singapore to keep adapting and moving ahead, not just patching things up. He also gave an overview of his learning points, but he also focused on the specific context and structure of Singapore. So, although we can learn a lot from other countries, and we have to learn a lot from Singapore, but we need to take the context and culture into account.
Sounds like we'll need another episode just for the lessons you, Ad, and all the others brought back, Kris. But what if I give you half a minute to explain us your own personal conclusion? What would be your message? Let's call it your elevator story, so no more than 30 seconds.
Well, I would say that Singapore shows how even a small country can build a future-proof health system by committing to long-term policy, strong coordination, and integrated care. Primary care is the backbone there, with a regular family doctor, multidisciplinary teams, and a solid digital infrastructure that support continuity and early intervention. The links between hospitals, community care, and home care are seamless, with clear pathways and responsibilities. Their digital approach, with one shared record and common standards, reduces pressure and improves quality. Most of all, improvement is driven by a learning culture rather than administrative checks. For the Netherlands, Flanders, and Belgium, the key message is that real progress requires clear regional leadership and consistent policy across years and generations.
Interesting conclusion. Leadership and consistent policy across years and generations. Not easy, but I think you are correct. So let's leave it there for today, on the note that systems don't transform overnight, but coherent, brave choices can go an awfully long way.
Absolutely. I learned so much from this visit, and I hope our listeners found something useful too. Together with my colleagues Relinda and Wilma, we are actually preparing an overview document with learning points. So for the people who want to find out more, please follow us on LinkedIn, and during the following weeks, we will publish our findings. So see this podcast as a kind of teaser for what is following. Many thanks, Jolene, for hosting this podcast and for the conversation, and I look forward to the next one.
Thank you, Kris, for bringing Singapore's story to us in such depth. That was Singapore Through a Quality Lens. We'll be back, so take care, everyone, and goodbye for now.
Thank you, Jolene, for our first podcast together. You did great, and I look forward to collaborate again. Goodbye, and thanks to all colleagues worldwide for listening to this new episode in my podcast series. And a special thank you to the group of Dutch friends who inspired me for this episode. And so thank you to Ad, Alitha, Anne-Katrien, Annette, Anouk, Bas, Charlotte, Davy, Dominique, Erio, Ernst, Esther, Hans, Ilse, Janneke, Jeroen, Joris, Judith, Christel, Maartje, Malika, and also Maria, Martijn, Maud, Michael, Noor, Peter, Poek, Pim, Relinde, Rose, Thomas, Ton, and Wilma. Singapore was super, but the conversations with each of you were my mango moments during that week. Thanks again to all, and goodbye for now.